Well, there was a real sense of urgency and alarm being expressed by the WHO as they organised this press briefing out of their regional headquarters in Cairo. It is from there, obviously, they are monitoring the situation in Sudan with real concern about what is happening there. We heard them speak about the number of people which have already been killed. Two quite big admissions we heard. The first being they believe there's been a major underestimation in terms of the number of public fatalities which have been disclosed by authorities there. In other words, they think many more people may have been killed than we already have heard about. Secondly, they say they believe the majority of those that have died are actually civilians that have been caught in the crossfire between the army of Sudan and the rapid support forces who continue to exchange gunfire. One of the key people we heard from was Dr. Richard Brennan. Now, he is the WHO's Regional Emergency Director. He said that already the WHO had been sending in medical supplies to Sudan because they were cautious something like this could happen. He said those supplies, though, are starting to run low and international support is standing by, ready to go and help.
Prior to the escalation, we'd already distributed essential supplies to the major hospitals in Khartoum, including trauma kits. Right now, those supplies have largely been exhausted. We have a very large logistics hub in Dubai. We have reserved a large section of that logistics hub for Sudan specifically. As soon as the situation allows, we'll either bring those either by air freight, but you know that no commercial or charter flights can land in Khartoum right now. But the other option is by sea and then by road.
We also know that a number of hospitals across the country are really struggling to function. There is a lack of fuel, there is a lack of medical supplies, food and electricity. It is a very difficult situation, it would seem, for health workers on the ground, particularly those who are trying to travel either between their home and work or between medical facilities. We got some insight into that from Dr. Nima Saeed Abid. Now, he is the WHO's representative in Khartoum. It was difficult at times for him to join the press conference because of connectivity problems, but when he could speak at that press briefing, he explained just how precarious the situation is on the ground.
It is the most dangerous situation in Sudan currently is to be on the road, because maybe you are in hotspot, but sheltered in one protected room, but on the road, it's completely different because there is street fighting, there is different checkpoints, and you don't know, you can never predict what will happen. So it's really, the situation is extremely difficult right now.
The grim reality is, the longer that this fighting continues, the more innocent people that will die, civilians caught in the crossfire. And it is for that reason that we know there are some very high-level diplomatic discussions taking place right now between those key stakeholders in Sudan and the likes of the African Union, the European Union, and regional players like Egypt and Turkey are all working really hard to get both sides to agree to a ceasefire and to lay down their weapons, because I think there is a very real understanding in the region that the longer this fighting continues, the higher the risk is that it really could spiral out of control and impact not just the people of Sudan, but those right across the region. Trent Murray for SABC News, Berlin.